April is National Minority Health Month. While health disparities exist, there are many organizations throughout the First Coast looking to help residents. Mayo Clinic is one network efforting change. Joining me now is Dr. Gerardo Colon-Otero, a hematologist and oncologist from Mayo. Thank you so much for joining us this morning.
Thanks for having me.
Absolutely. When we talk about these disparities impacting minority communities, what disparities are we talking about specifically?
So disparities in outcome of different healthcare conditions exist in multiple conditions that were first recognized back in the 1970s, early 1970s, as it relates to cancer, when we started collecting data on race and cancer outcomes. And those disparities still persist in cancer. They are less marked. They're more marked among the African American population, but they also exist in all other conditions. This year, they become more evident with the COVID pandemic, where we had definitely seen higher mortality and a higher severity of the COVID disease among African Americans, Hispanics, as well as Native American populations, as reported this week by the CDC. And the reason for that, for the higher mortality among COVID, is multiple reasons. But one of which is the higher prevalence of obesity and hypertension among African Americans, which also predispose them to other conditions, including breast cancer, endometrial cancer, and stroke, among others.
Interesting, because it's almost as if it's like a domino effect, if you will.
Correct. So similar condition prevalence of more comorbidities or different conditions like obesity and hypertension, increased risk for multiple diseases. And then having these diseases also worsens the outcome of other diseases like cancer and COVID, for example.
Dr. Colon-Otero, how has Mayo's work helped bridge the gap with minority health and people among these communities?
So Mayo in Jacksonville has been involved in efforts of addressing disparities for at least the last 15 years. And those efforts are increasing with the COVID pandemic. Mayo has been involved in reaching out to our African American communities, collaborating in collaboration with African American churches, Hispanic churches, as well as Agape Clinic, for example, Volunteers in Medicine, providing access to testing and providing access to the vaccines, for example. We have partners with them in providing access to patients with cancer that need access to cancer clinical trials in order to improve the outcomes of cancer.
When you talk about solutions, do you think part of the resolution is that of having more diversity among healthcare workers?
Definitely having more diversity among healthcare workers is a critical component. And we have multiple initiatives along those lines in education, in providing exposure to cancer research, for example, and research and healthcare education among our high school students, college students at the Mayo Clinic.
Absolutely. People watching right now who need help or want more information, where can they go to do so?
So we have the Mayo Clinic website, provides information on cancer, on health disparities, and also our Center for Health Equity and Community Outreach Research, which was just formed to direct these efforts within Mayo.
Dr. Colon-Otero, thank you so much for joining us this morning. We appreciate it.
My pleasure.